When you're smiling, the whole world smiles with you. When you're laughing, the sun comes shining through. Keep on smiling, 'cause when you're smiling, the whole world smiles with you. Ba 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 da ba.
Hi, I'm Dr. Kenny Levine. Welcome to Health Talk. Health Talk is seen on UVerse Channel 19 and WEYW19.com. I'm a dentist. I'm a periodontist. But this show is not about dentistry. This show is about your total medical health from the top of your head down to the bottom of your feet. And we're going to have different medical and dental specialists and support personnel, which we're going to interview every week. And tonight, it is my really extreme pleasure to have Richard Geronemus here. Richard, welcome.
Thank you.
I need to give you a little bit of an introduction because you and I know each other really well. Richard is one of my dearest friends. He happens to be a dentist. He happens to be my dentist, and we share a lot in common, don't we?
We sure do.
Tell us a little bit about your background, how you got into dentistry. Maybe you didn't have a choice.
Well, I thought I had a choice, and I started off in law, but I quickly came to my senses. And dentistry is in my blood. And my dad was a dentist, his two brothers, and they were in Hollywood, were a dentist. I practiced with my dad for 20 years. I have an aunt who was a hygienist. Her brother was a well-known periodontist
Right, Morty.
in Miami, Dr. Rosenbluth. My mother's brother was a dentist, and I have a first cousin who was a dentist. So I was trapped. I was there.
You were raised, you're a little bit unusual because you were raised down in South Florida.
I was born here. I was the last class out of the old Fort Lauderdale High. I went to Tulane undergraduate school in New Orleans, and I had a choice of dental school being in the South or going north, and I really felt I was coming back to my dad's practice. And we chose, I got married before my freshman year, who I am still married to, going on 48 years now.
If you behave.
If I behave.
Right.
And it was a great experience for us in New York. I was in the Air Force for 2 years after, where I got tremendous clinical experience. And we are now long-time, Fort Lauderdale residents coming back. Our kids grew up here. And life has just been beautiful in that way.
Things that I'm doing now in my practice are not what I was taught in school, and certainly I know you well enough to know that's exactly how you feel.
Oh, absolutely. I don't think there's a thing that we do from the very basics now that we learn in dental school, and that's been the exciting part because you keep. But I feel now that it just gets better and better. And the equipment we have, the materials we have, it allows me to have fun and more fun. And that's why I still do it, and that's why I have no intentions not to do it.
Me neither. When I talk with restorative dentists, I know what you can do. I'm amazed at the aesthetic, the cosmetic things that you can do for patients. When we were in school, we were told that we had to drill a hole and we had to make it wide enough so that there could be retention to hold it in place until somebody ended up needing a crown. Today, it's all different.
It's all different.
So why don't you talk a little bit about bonding and how that got started?
Well, bonding was started by a Dr. Erwin Smigel, who is recognized in the Smithsonian, and the museum is in Baltimore, as the father of really modern bonding. And I started with Erwin as a protege of 30 years ago. And we were doing things that almost were considered heresy to what we were taught as far as the aesthetics, that it just wouldn't work, it wouldn't last. And it's just progressed, it's gotten more sophisticated. We started with direct bonding, using our hands with materials, going from that to porcelain bonding and the different types of porcelain bonding. Some were weaker, some are now very, very strong. and conservative and preserves tooth structure and actually makes tooth structure stronger. So you have the aesthetic change and you have the strengthening change. And as we get older, our teeth desiccate from within and they become brittle. And that's why color change.
Well, let's talk about getting older in just a minute. We're going to get back in a minute with you. It's Dr. Kenny Levine with Health Talk, and we'll be back in just a minute or so. Thank you.
When you're smiling.
First impressions are priceless.
I'm Dr. Kenny Levine. For the past 37 years, we've been helping patients of all ages restore their smiles. Today, with modern technology and lasers, we're able to treat infants of 7 days old. We treat their parents. We help them not only keep their teeth, but restore function for the rest of their lives.
Call 954-603-7109.
Hi, I'm Dr. Kenny Levine. Welcome back to Health Talk. We're seen on UVerse Channel 19 and WEYW19.com. I'm here with my good buddy and dear friend and wonderful dentist, Dr. Richard Geronemus. Richard, I am amazed at what you and your restorative colleagues can do. If they took away my license to be a periodontist, I had to go back to become a dentist, I'd have to go back to school for about 3 years to catch up. By the time I got caught up, things would change again.
That's right.
You have a lot of materials in your office that have come and gone. You must have a lot of things that you don't use anymore. How does a dentist, somebody out in practice, not somebody in a university setting, keep up with the latest, the leading edge of what's happening in your field?
Well, that's a really, really good question. And you don't want to follow what the detailed salesmen, want to sell you. You have to really research it. You go to the experts. You go to meetings. The Society of Dental Aesthetics that we are both members of meets once a year, and they have for 3 days incredible meetings. They have lunch seminars. They have breakout seminars.
Hands-on.
You learn as much from the seminars as the guy sitting next to you or the woman sitting next to you, as far as what they're doing. Extremely, extremely important. And very surprisingly, the newer materials are necessarily the better materials. Right. Unfortunately, companies are driven by stock, their prices, and always to come out with another product. It doesn't mean it's better. So you gotta be careful, otherwise you will have drawers full of materials that you're not happy with. So there are many, many courses. Dr. Strupp in the middle of the state. You have all the respect. The Florida Dental Association has a meeting once a year. These are where you learn. You look, you listen to your detail person, you read all the literature that comes out of the magazines, but then you go to these meetings and you ask questions.
My mentor was Dr. Mort Amsterdam, who was the father of periodontal prosthesis, and when I was in school, I remember him saying that you can have 2 guys out 25 years. One guy will have 25 years of experience. The other guy may have 1 year of experience 25 times.
That's a very, very well put. And there is a difference in practices, as well. Because unfortunately, in today's day and age, with computerization and insurance, everything's got a number. And when you come to our office, the bottom line isn't what determines what you get or how we approach your health care. It's very, very important to look at the patient, I feel that I am a dental health doctor. I am not a tooth doctor, all right? Our practice is, we charge for a service that's given to the patients. We don't have to look on an insurance code to see, is it going to be covered and are you going to get it? Because if it's not covered, you're not getting it.
Right.
So we do so many things to protect general medical health, which there are no codes.
Well, there are tremendous relationships today that are established between periodontal disease, which I treat, with heart disease, stroke, diabetes, low birth weight babies, pancreatic cancer, Alzheimer's disease, and it just seems to be growing and growing.
Absolutely.
I interviewed a veterinarian before. He said, you know, the mouth is the entry gate to the whole body, and it's true. And if we can make people healthier in their oral cavity, many of their medical conditions will be easier to control.
Oh, there's no question. I tell my patients, the mouth is in between the brain and the heart, and don't think we're all connected. So there are certain aspects that are changing that patients have got to be aware of. And oral cancer is one of these situations where you think that people are not smoking or chewing tobacco. Oral cancer is rising. And why is oral cancer rising? It's because now it is a sexually transmitted disease. It is the HPV virus that is causing it. Now, that's the bad news. The good news is it's a little bit easier to treat and quite not as invasive. But you have to be aware of that aspect of the causative factors. And parents have got to be aware. You inoculate your children with Gardia, both girls and boys, at the time to protect them, because the HPV virus can surface at any time in their lifetime.
Okay, we're going to get back to oral cancer in a moment. It's Dr. Kenny Levine with Health Talk. We'll see you in just a minute. Thank you.
Smile, though your heart is aching.
Smiling is infectious. Yes, it's true.
I'm Dr. Kenny Levine with Health Talk. Seen on the web at WEYW19.com on Uverse. I'm here with Dr. Geronemus. Richard, we left last segment talking about oral cancer. You know, April, I'm sure you know, is Oral Cancer Awareness Month. You and I have instruments that look for oral cancer. I have one, you have a different one. Oral cancer is a very, very aggressive and deadly disease. I have a brother-in-law who lost part of his tongue because of it. We were at a meeting together where this young doctor got up and talked about how wonderful his life was, and one day he couldn't button the collar on his shirt, and he ended up having oral cancer on the base of his tongue and also in his neck. And the 5-year survival rate, if left untreated, is very, very disappointing.
But the 5-year survival rate of early detection
Right.
is very encouraging. And
Yes.
that's why you and I are one of the few that have a special light that helps us see different types of circulation that are clues to a tumor developing. I
Correct.
don't believe in the rinses and the dyes to determine if something's already there, is it malignant or not. My feeling is if something is there, that doesn't belong, you take it out.
Absolutely.
You know, so
So-
there are early good statistics. You procrastinate, you're in trouble.
Let's talk a little bit about restorative dentistry now. We talked how things are less invasive, more conservative from your end. You're drilling less tooth than you used to have to drill.
Absolutely.
In your career now, as the generations get older, are you seeing less decay or more decay?
Well, when you take care of a population that varies from 20s to 100,
Right.
or even 100, you know, you see the effects of different phases of their life. And I think that the younger age groups from 30 to 50 are very, very conscious of their smile, their dental health. It's a major factor with them in getting promotions, in selling a product, in being respected. There'd be nothing worse than having a bad mouth and trying to sell a product, because it's a distraction and makes you look older, and in this time, economic times, you can't afford that. But unfortunately, the older we get and we're dealing with extended life, patients are on more medications, they age, the saliva dries, and they become they get more caries, they get more decay. And we have to deal, and we have a fine line, and it becomes very difficult. Do you decide what to do for that age of patients? You really have to say to them, what the best dentistry is, and let them or their family decide, what the good choices are. A bad choice, I won't give. There are a lot of other offices along the way that they can go to for that. But there's always several different good choices to take.
People say, am I too old to do this?